There we are. Good morning, Dr. Korman.
Good
And how are
morning.
you doing?
I'm doing awesome this
Yes,
morning.
you are. That's awesome. Good. Thank you so much for doing this live webinar with us this morning. We really do appreciate that. For those of you that are just joining us, welcome this morning to a little more insight about osteoporosis with Dr. Laura Korman. So Dr. Korman from Korman Relief and Wellness Center down on Toledo Blade. Dr. Korman's been a chiropractic physician for over 30 years in the community, and she has her diplomat of, I don't know if I'm pronouncing that right, diplomat of nutrition. So very few physicians in the country have this. What does that mean? It means that she has studied a lot more than, you know, most nutritionists, maybe, if that's the best way to describe it. So she's put in many, many, many hours and continues to do so as well through continuing education and all of that good stuff. So she has also known for her functional medicine. So, you know, coming away from, not that we don't sometimes need, you know, medications through our physicians. So this by no means replaces what your physician tells you, but Dr. Korman has a whole host of functional medicine methods that she teaches to her patients, and it works really super well with all of without side effects and that sort of thing. So a more natural way to look after some of the things and conditions that people are living with. So I'm Julianne McGrady. My colleague is online too, somewhere out there, Heather Pack. Real brief, I own Jam Fit, and we are, for those of you that don't know us, I don't know if there we go. You can look us up on yourmovementsolutionsinfo.com, our website, or email us at yourmovementsolutions@gmail.com. And we are integrative movement specialists, which means we work with individuals living with osteoporosis, arthritis, sciatica, spinal stenosis, any conditions that may be limiting you from doing the things that you need, want, or love to do. So send us an email and or look us up online, and we'd be happy to work with you. And we also, on our email list, and this is the platform that Dr. Korman is using this morning, we do these live webinars about every 2 weeks or so. And Dr. Korman, this is her second webinar with us, so welcome again. So I will turn it back over to Dr. Korman now, and let me just let me see how I've got to turn her back over to the host. And I'll just put myself on mute.
Okay, can you hear me? Okay, awesome. Well, thank you, Julianne, again, and Heather for inviting me to do this webinar. I'm very passionate about this topic. It's not talked about very much, and I really don't know why that is, because osteoporosis is a chronic illness that's growing at alarming rates. And it, just like other chronic illnesses, heart disease, cancer, obesity, diabetes, Alzheimer's, you just don't hear much about this one. And so I'm gonna share my screen here. Let's see. This is where I had a hard time last time too. I can't see this, can't get rid of this bottom thing down here to share my screen. So do this. Okay, let me click up here. There we go. Slideshow. Start. Okay. So again, osteoporosis is growing at alarming rates. In fact, the National Osteoporosis Foundation states that 1/2 of all women over the age of 50 will suffer a fracture due to osteoporosis sometime in her lifetime. 1/2, that's 50%. 8.9 million fractures are happening annually worldwide due to osteoporosis or osteopenia. That is one fracture every 3 seconds. That equals to 28,800 fractures a day. And we don't hear about that on the news, do we? The other thing that's alarming about this disease is that it's deadly. 24% of people who suffer a hip fracture will die within the first 24 months of having this injury. That's a huge percentage. It's a very deadly disease, and we don't think about that. In fact, it's a #1 cause of falling. They say that some people will have a fracture and then fall. Some people fall and then have a fracture. So we know that 65% of people, I mean, over the age of 65, people over the age of 65, the #1 cause of death is falls, and osteoporosis is part of that. The other reason why I'm so passionate about this disease, let's see if I can get over here. For some reason I can't go on to the next slide now. Let's see. Is that happened to me? Ooh, let me go back. There we go. Is that the fracture actually happened to me. This is my foot. And you can see in the crack in one of the bones there off to the right side, kind of right lower side, you see that hairline fracture there in my foot. And this happened to me in 2011. I was shopping with my daughter at Macy's, and I bought a pair of shoes, new shoes. It was these cork platform shoes, and I had put these shoes on and was kind of dancing around a little bit in my shoes, and I rolled my foot. I sprained my which I thought was a sprain, but I sprained my foot, and I was so mad at myself because I had planned on going running that afternoon and realized I wasn't going to be able to run it, and I wouldn't be able to run for a while. Well, after a few days, my foot continued to hurt me, and so I took an x-ray of my foot in my office, and this is what I found. So I said, oh no, I broke my foot. So I got myself a boot and made an appointment with my orthopedist and to make sure I was doing everything correctly. And he said, yes, I would need to wear that boot for about 5 or 6 weeks. And I said, 5 or 6 weeks? What about 3 weeks? And he said, no, you're not 23 anymore. I said, ouch. So, and he said, I want you to have a DEXA scan. And I said, why would I need a DEXA scan? And he said, because you shouldn't have broken your foot at age 48. I said, oh. So sure enough, I had a DEXA scan, and I had osteopenia, which is early osteoporosis. And so I thought, wow, if this can happen to me, this can happen to anyone. And so what I had discovered just prior to this fracture is that I had a vitamin D deficiency. And vitamin D, as I spoke about a month ago with our immune system, is very, very important in keeping our immune system, is also important in keeping our bones strong. And 70 to 80% of people are deficient in vitamin D. It's not tested typically on the annual blood profiles, and it needs to be. It's an epidemic in our country, and vitamin D is paramount in preventing bone fractures. So Julie talked about functional medicine. What is functional medicine? So functional medicine is about asking the right questions. So we want to know why. Why is there an epidemic in osteoporosis? Why are our bones thinning out? We want to find root cause resolution to a state of dis-ease. So we want to find out what's causing dis-ease before we have the disease, right? So medical practitioners will diagnose us with a disease, and then they'll have a treatment protocol. Okay? With functional medicine, we want to get to root cause and ideally prevent disease. And so that's what I do as a functional medicine practitioner. So I'm going to take you along with me today and look through the lens of a functional medicine practitioner on how to treat and manage osteoporosis without drugs. So today I'll be covering what osteoporosis is, why it's so prevalent in our country, and why mainstream medical treatments are ineffective, and how we can manage and treat osteoporosis with functional medicine, nutrition, and lifestyle strategies. So the word osteoporosis actually means porous bones. It's where the integrity of the bone is compromised and becomes weak. Some people get osteoporosis and osteoarthritis confused. And osteoarthritis happens in the joint. Osteoporosis happens actually in the bone matrix. Bone is a living tissue. It's a living tissue which is constantly being remodeled. It's building up new bone and removing new bone. This process is happening over and over again. In our younger years, new bone is growing at a greater rate that bone is being broken down. Peak bone mass is reached between the ages of 25 and 30 years of age. And so this is a very, very important piece of information, because once peak bone mass is reached, it's after that point that our bones actually gradually become weaker. The question is, how fast is our bone becoming weaker? We want to keep that as slow as possible. So osteoporosis then will occur over a prolonged period of time when this process of bone breakdown is occurring at a faster rate than new bone growth is occurring. So here's a picture of a healthy bone on the left side of the screen, and osteoporosis on the right hand of the screen. You can see that there's more gaps and holes, and that bone is weakened and more susceptible to fracturing. So who's at risk for osteoporosis? Age. So when we increase our age over 30 years old, because that's after that peak bone mass has occurred, we're at risk for osteoporosis. Females are going to be at a greater risk than males are. And part of that is because we don't have this same muscle mass that's constantly a greater muscle mass has a constant tension on the bones, which will strengthen them over time. Females also have hormonal changes, especially at menopause, and childbirth, I guess I should say pregnancy and breastfeeding can also decrease our bone mass. Inactivity is a huge, huge, huge promoter of osteoporosis, and we have become a sedentary society, and especially our youth. We're on our phones and computers, and we need to become more active. Lack of sunshine, again, that's the vitamin D deficiency, because most of our vitamin D is obtained through sunlight on our skin. And because of the scare of cancer, skin cancer, many of us are avoiding the outdoors, or we put sunscreen on, which is decreasing our production of vitamin D. Smoking is a risk factor. genetics and ethnicity. So we could have genetics in being able to metabolize vitamin D, which is a problem, and ethnicity. White Caucasian and Asian women are more susceptible to osteoporosis than our African American, and also the Latins are a little less risk for osteoporosis. Medications including steroids and prednisone, and all the proton pump inhibitors, the antacids including Nexium, Omeprazole, Prilosec, and Zantac, they decrease the absorption of vital minerals, including calcium and magnesium, which are important for building bone. And I'm finding that now that some of these medications are offered over the counter and are way overutilized in our country. So why mainstream medical treatments are ineffective for osteoporosis is, again, the treatment is reactive versus being proactive. And that means that treatment is usually only started after a positive diagnosis via a DEXA scan, with little to no advice given on prevention beforehand. So again, it's reacting to the diagnosis versus being proactive and being preventative. So treatment is typically the prescription of a class of drugs known as bisphosphonates, including Fosamax, Octanel, Actonel, Reclast, and Boniva. These drugs have numerous side effects, including bone or muscle pain, nausea, fever, headaches, heartburn, ulcers, and can increase our risk for esophageal cancer by 2 times. These drugs also compete with the absorption of calcium, magnesium, iron, zinc, and copper. Many of these minerals, again, are important for the matrix of building strong bone. So if you have low blood calcium, you won't even be a candidate to take these drugs because it's known to decrease your calcium even further, which would make obviously osteoporosis worse. The bisphosphonates interfere with the normal remodeling of bones, and this is what's important. So it attaches to the bone matrix, and it interferes with this remodeling of building up bone and tearing down old bone. They become brittle. Bones become more brittle because they have these deposits in there that are not normal bone tissue, and it can cause these microscopic cracks in the bone. This lessens the tensile strength or flexibility that normal bone has and can actually cause them to be greater risk for fracturing. It's not a good answer for osteoporosis. So again, prevention always trumps intervention. Osteoporosis is a chronic disease, just like heart disease, diabetes, cancer, and Alzheimer's. And 80% of these chronic diseases are driven by lifestyle choices. So let's talk about these. When do we start preventing osteoporosis? When we're young. We talked about that peak bone mass, right? It's our children, and healthy lifestyles are learned. So we need to make sure our youth are active and that they consume healthy, whole, and unprocessed foods. So how do we prevent osteoporosis? We need to get out of our chairs and exercise, right? We've become a sedentary lifestyle, and sitting has become the new smoking as far as increasing our risk for mortality of all causes. And getting outside. We need to get outside. Careful not to burn. So, some would say, well, sun causes skin cancer. The lack of sun also causes skin cancer. So what is the answer? The answer is more sunshine on a daily basis, but not enough to burn, okay? So sometimes it's all or nothing with us. We don't get enough sunshine and then we burn, and that's not good. So healthy daily sunshine is important. Getting rid of the sugar and processed foods. Soda pop in particular is an increasing risk for osteoporosis, especially in the youth. We need to limit our omega-6 oils, which are inflammatory. So where do we find omega-6 oils? They're in almost every single salad dressing that you find on the grocery shelf. So even though we might be trying to eat a healthy salad, if we put these unhealthy vegetable oils on our salads, it's going to be an inflammatory oil. Now, we also see some of these omega-6s in nuts and seeds, which are healthy, but we want to make sure that these omega-6 oils are not consumed in greater abundance than our omega-3 oils. Omega-6 oils are inflammatory. Omega-3 oils are anti-inflammatory, and they need to be in a proper ratio. We need to optimize nutrients, including vitamin D, calcium, and other bone-building minerals like phosphorus and magnesium. Collagen is also really important in making sure that our bones stay flexible. And most of us are not consuming enough collagen building proteins. And then here again, the omega-3 fats, which you find in fish. And with the toxins that are in a lot of large fish, we want to consume smaller fish. And most people are not getting enough omega-3 fats in their diets. We also can have functional medicine testing, including a urinary Purlinx D test, which is a simple test that can be done actually at home with an at-home kit that measures the rate at which your bones are breaking down or losing calcium. And this test is really a vital and important test because unlike the DEXA scan, which just gives us a picture of where our bones are and can only be repeated maybe once every 1 or 2 years, this Purlinx D test will actually tell us the rate at which our bones are losing calcium or losing bone mass, and can be repeated every 2 to 3 months. So if we're implementing a nutrition strategy or a healthy strategy to maintain bone mass or even increase bone mass, this test will allow us to tell if we're on the right path rather than waiting 1 or 2 years for another DEXA scan, and we could be missing out on those 2 vital years. Hormones, we can test for hormones, including stress hormones and sex hormones like estrogen, progesterone, and testosterone, which are important, especially in a postmenopausal women in maintaining bone mass. And then we can also check for micronutrients and minerals like vitamin D, vitamin K, and then again, that omega-6 to 3 ratio, which are going to be important in making sure that we're holding on to our bone as we age. So how do we treat osteoporosis naturally? So again, we want to continue these preventative lifestyle strategies. And then we can supplement with high calcium supplements that assimilate into the bone matrix, like microcrystalline hydroxyapatite. This is a type of calcium, which I prefer, which is derived from bone, from organic pasture-raised cattle. So I often say the best way to build our bone is by consuming the minerals that are already in bone. That's the best way to get the right ratios and amounts that actually will be able to incorporate into the bone matrix. We want to make sure that we consume adequate vitamin D3 and K2 together to help not only absorb the calcium in our diet, but also to be able to direct that calcium to the bone and away from other soft tissues, including the arteries. So what happens, we often hear that we need to consume more calcium, but if we consume a large amount of calcium and even vitamin D, but we don't have K2 to tell the body where to put this calcium, oftentimes this calcium is deposited in the gallbladder or the kidney and produce stones, or in the joints, or in the arteries, producing hardening of the arteries, which is not what we want. So K2 is very, very vital in making sure that the calcium is distributed away from soft tissue and into the bones where we want it. So I think that we find that we actually need less calcium than we thought previously to help maintain bone mass, as long as we have adequate D3 and K2 together to again direct this calcium into the bone. And then again, collagen is very essential to increase this tensile or flexibility of bone. Collagen again can be found in consuming healthy bone broth, which a lot of us have gotten away from. We look back to our ancestors, our parents and grandparents, often cooked with bones. They didn't want to waste any part of the animal. And we found that there was a lot of nutritional value in consuming bone broth, and one of them is collagen. So which phase of bone health are you in? You're probably finding that you're in one of these three phases. You could be in a phase where you just reach peak bone mass, or maybe you're, I would say, under the age of 40, and you wanted to maintain healthy bone mass. And so then I would say that you want to maintain some of the healthy lifestyle strategies that I talked about in the webinar. Maybe you're in your 40s and you've had some hormonal imbalances. Maybe you have a family history of osteoporosis. Maybe you are reaching early menopause and are concerned, or maybe you were like myself and diagnosed with osteopenia or have already fractured a bone. So in that case, you may want to do some of the functional medicine tests that I had recommended, find out what your nutrient status is, especially vitamin D, and maybe look at your hormones, and maybe look at a Pure Links D test to see how quickly your bones are breaking down. This would give us a good way to monitor progress going forward with a natural program. Or maybe you're already postmenopausal and have been diagnosed with osteoporosis. Maybe you're on some of these medications. Maybe you don't tolerate them well, or maybe you want another approach. So in this case, I would definitely recommend that we would do some of the micronutrient testing, maybe some hormonal testing, the Pure Links D tests, to find out where we need to go and make sure that the treatment strategies that we implement are working for you. So in either one of these phases, I am able to help you. And if you would like to take a deeper dive with me, I can help you. And we could start with a free discovery call, which I'm going to offer to all of you that are listening today. And what that would involve, when you'd call my office and they would give you some forms to fill out. And so I can look at them before we get on a call together and to find out what of those phases you're in and how I can best help you. So we'll spend about 15 minutes just to find out which phase you're in and how we can proceed from there. I also have some new equipment in my office that helps women with osteoporosis. It's called a pulsed electromagnetic frequency machine. And this machine actually is FDA approved to actually heal bone fractures that are, some people have, again, difficulty healing fractures, and this is a way to heal these fractures. I can use it in my office to actually help strengthen bone that's already been weakening throughout your body. So this would be something that would be very beneficial for someone who's already developed osteopenia or even osteoporosis. And so if you would be interested in this discovery call, please call our office and we can get you the forms to fill out and we can go from there. I'm going to see if I can turn this back over to Julie, and if she wants to come back on. And
yeah, thank you, Dr. Korman.
You're very welcome.
So much. This was very informative. And I just have to ask all the participants out there, well, who stood up at their computer when Dr. Korman was talking about inactivity and our technology? So again, we're doing a lot of sitting these days. We need to be up, we need to be moving, we need to be active. That's part of, keeping our bones healthy. So 2 questions. First of all, what is the ratio in the US versus other countries when it comes to osteoporosis?
Oh, I'm sorry.
That was for you, Dr. Korman.
Oh, I'm sorry. What was it now?
So what would you say the ratio is in the US and osteoporosis versus other countries?
Oh, that's a really a good question. I don't really have the statistics on that, but I can tell you it's going to correlate to the poor lifestyles that we lead in, that we live in our country. So if another country has similar lifestyles, it's going to be similar rates, right?
That makes sense.
Yeah, so yeah, and that's going to be even in the states, in the United States. So the states that are more active, that are outside, are going to have less rates of osteoporosis than those that are inside. They don't get the vitamin D, they're inactive. It's going to correlate to lifestyle, directly to lifestyle.
That absolutely makes sense. And then the other question is vitamin K2. It's found in animal foods and fermented foods. Can you go into that a little bit in detail, please?
Well,
because I think most people haven't heard of it or know about that.
Right. Yeah, K2 can actually be made in the gut from healthy bacteria, which a lot of us are don't have enough of, insufficient in that healthy bacteria, and can be found in fermented natto bean. So I usually recommend that most people supplement with it because it is so inefficiently made. Most people are going to be deficient in it. So again, if they have osteopenia or osteoporosis, are going to be taking calcium, I recommend that they take it with, I take vitamin D and K3 together in a supplement.
Got it.
So I recommend that, again, with the prevalence of osteoporosis in our country, prevention is key. And again, vitamin K2 is so important, not in bone, just in bone mass, but again, keeping calcium out of the soft tissue, including our arteries. So I think it's a really vital nutrient.
I think that's the big take home for me today is I didn't think of it going into the arteries as hardening the arteries. And we've all heard about the hardening of the arteries, but I think we really pair that up with, well, that's a natural, path of aging where it doesn't have to be that way.
Right.
So that was a big take home for me today. That was awesome. So if anybody else has questions, go ahead. How much K2? Somebody's asking.
They say 60 micrograms a day is sufficient. Some people might want to take more. Again, I would look at that in an individual case. If someone has a lot of hardening of the arteries or they're having, stones that are forming, I might put them on a higher dose, at least for a while. But 60 micrograms is a daily dose that seems to be safe and adequate for helping with bone metabolism, or making sure the bone stays out of the soft tissue and into the bone.
And somebody asked, you have a recommendation for a supplement D3 plus K2. Does the quality count? Because that is a great question. Thank you for that, because I'm sure it does, but go ahead, Dr. Korman. What is
so vitamin D is a fat soluble vitamin, and so it's best taken with a little bit of fat. So you'll oftentimes find vitamin D in a soft gel, and it has an oil in there. So I always look at what the oil is inside the capsule, and oftentimes it's a soybean oil, and I wouldn't recommend it. So most soybean in our country is genetically modified, and it is an inflammatory oil. So I prefer other types of oils in there that would be less inflammatory. If it's in a capsule, you may want to make sure that you take it with some fat to, again, help with the absorption of that vitamin D and K2, as both of them are fat soluble.
And you have that in your office. You can sell,
yes.
You sell that. Yeah. So another question, can you take too much D3? And what is the difference between D3 and D2? These are great questions, guys.
Yes. Yeah. Yes. Yes, you can take too much of any of the fat soluble vitamins, and that's why I always recommend that you test. Vitamin D3 is cholecalciferol. It's going to be the one that's active. It's going to be the one that we actually make and absorb from the sun. And D2 is not bioactive. It's not a bioactive D. So you want D3, and you want to get your levels measured. And I can't state this enough because everybody absorbs vitamin D differently from their skin, and there can be genetic differences. And so the lab values for normal is anywhere from 30 to 100 nanograms per milliliter. And unfortunately, if you typically the mainstream medical profession will say anything over 30 is in the normal range. It's in the low normal range, and I don't recommend that low normal range as being optimal for your immune system or for osteoporosis. So we want to get those levels up to about 60 to 80, nice in the mid to high range, especially if you already have osteoporosis and you're trying to optimize that bone health as much as possible. So you need to get those levels measured, getting to the range of 60 to 80 nanograms per milliliter. For most people, a safe dose of vitamin D3 is anywhere from 2,000 to maybe 4,000 international units a day.
And those numbers are good to know, because I think we just tend to trust our, physician to know all these numbers and everything. And where some of them do, again, their scope of practice really isn't down deep into that nutrition end of it.
Again, with the medical doctors, their way they practice, especially with third-party payers, is they have to have a reason for justifying treatment. And as long as, if they're looking at that blood test and it's in the normal range, they can't justify a treatment because it's in the normal range, you see?
Yeah, and so that's the problem. And that's why you were saying, try to prevent, but once you're there, again, there's other things that you can be doing. So
Yes.
Another question, so do you do the D test in your office, or do you have to go through your physician? And I know that you do work with some physicians there, so maybe that's from Marie.
Okay, yes. So I can order a vitamin D test, or you can get it through your physician. It's some doctors are ordering that annually with the annual, blood panels. It is an add-on, and some doctors are still not ordering it. So you can ask your physician to run it, or you can contact our office and I can get that test for you ordered.
Great. Yeah, I know I have to ask mine every year, and it's because I am deficient in it, because I don't get outside. I'm one of those.
Mm-hmm.
Not because I don't like to be outside, but again, I think we think of our skin before anything else. It's on the outside. We see it. We burn. I burn. So yeah, that's a good point. So Sen, what is a good vegetable oil? Someone is asking. Extra light, olive oil. So what oils do you recommend?
Yeah, I definitely olive oil and avocado oil. Okay, our omega-9 oils, very, very important. I use avocado oil when I'm cooking. I use olive oil on my salads. You can also cook with grass-fed butter, like Kerrygold butter, and coconut oil. Those are my 4 favorite oils.
Wonderful. And I do have to mention the coconut oil is great, but I think for some people you have to be very careful. I do have a client that, because coconut oil sometimes is touted a little bit as, oh, this is the new, in thing. Mm-hmm. So she added a little coconut oil into her diet every day, and her cholesterol went sky high. So some systems, maybe not
Well, I would add to that then. Okay, so yeah, so when we're adding one thing, we need to make sure that we keep everything in balance.
Right.
And so with her cholesterol, you know, she would need to make sure that she's got her other omega-9 oils, like her olive oil and her avocado oil and her omega-3 oils in balance with that coconut oil.
Right.
Yeah.
Right. Okay, so I think we've answered everyone's questions. And if you have any further questions, you can call Dr. Korman's office, or you can email us at yourmovementsolutions@gmail.com. And I want to thank Dr. Korman today, our guest speaker. Watch for our up and coming webinar in the future with more from Dr. Korman. And if there's some subjects that you really would like to know about further, let us know. But we want to thank all of you this morning for your precious time and for spending your morning with us. And we hope that you learned at least one thing from this webinar. I know I learned more than one thing. So thank you again, Dr. Korman. And everyone stay safe out there. And we've got some comments coming in. Thank you for the interesting presentation. And it was very interesting, absolutely informative. So thank you all for coming this morning, and give us a shout, call Dr. Korman, and she'll of course give you a complimentary, what do you call that? A consultation over the phone. Is that what?
A discovery call. Yep. A discovery call. Mm-hmm.
That would be well worth your while. And for now, thank you. Oh, someone said, Dr. Korman is awesome. Of course she is.
Thank you.
All right. So thank you all again. Thank you, Dr. Korman, again. And stay safe out there. And we'll see you next time.
Thank you, everyone. Have a great day.
Bye.
Bye-bye.